I'll give you another minute to get this out. And if you have a chance, scroll through what other people are writing. This is absolutely wonderful, and I'll tell you why in a second. But first, I'll begin by introducing myself. And if we had lots and lots of time, I would love for us to get to know one another even more and deeply. I hope our program will give us that opportunity. My name is Katie Ryan. I direct this certificate program as well as the Arts and Humanities in Healthcare program here at CU Anschutz Center for Bioethics and Humanities. I'm especially interested in questions surrounding global health and culture, and I'm an associate professor in the medical school. So I want to kick off with the question, why consider this program? And in today's increasingly complex health landscape, I see professionals face challenges that require much, much more than technical expertise. And whether that means you are navigating difficult conversations with patients, or you're making policy decisions, or you conduct research on sensitive topics, or you're a teacher of the next generation, you need ways to thoughtfully engage with the human dimensions of healthcare and community health. Our graduate certificate program is designed to equip you with both practical and critical approaches that blend ethical reasoning with humanistic insight. You'll develop tools to recognize ethical challenges in your everyday work. You'll begin to or have advanced understanding of the diverse perspectives people bring on illness and well-being. You will address burnout and moral distress, and you'll deepen your understanding of health equity and social justice. So what makes our program unique is its flexibility. It's not like other degree programs that are offered at this university or others like it. Here, you can take just one credit course that addresses a specific topic that interests you. You can carry forward, complete all 12 credits of the certificate at your own pace. Or you can take those credits and put them toward additional graduate degrees, a master's in health humanities. The center is exploring ways to offer a master's program in bioethics. We have a lot of opportunities to take what you learn here and integrate it into advanced education. Our courses range from 1 to 3 credits, with many offered in asynchronous formats and online and hybrid formats to accommodate busy professional schedules. And we bring together professionals from diverse backgrounds. And what I wanted you to appreciate when you look at the chat window and to see so many different folks with so many different kinds of expertise, health expertise, clinical expertise, research methodologies, ethical perspectives. I mean, a class that you'll take in our program will reflect that breadth of knowledge. And I think that's really special, especially in settings where many of you work that are increasingly siloed and really are very narrowly focused. Here you get a space to think and breathe and explore and take intellectual risks and try out new perspectives to see how they feel. I think this creates a rich opportunity for you to learn from one another. And from the renowned faculty here at CU Anschutz and this center, which you may or may not know, you may not even know we exist, but we are in fact one of the nation's leading centers bridging bioethics and health humanities. You won't find many centers like this. We bring expertise in clinical ethics and public health ethics, narrative medicine, and community engaged scholarship, which addresses both local and global health challenges. And the curriculum you're going to hear about today, or even just a small piece of today, spans a wide range of topics from the art of observation and listening to addressing health stigma and moral distress. We even offer unique study abroad opportunities in Brazil and Poland that explore the intersections of health with history, culture, and social justice. So today, you're going to hear more about our upcoming fall semester's curriculum from each of our instructors. Then you're going to hear more about the application process. And then you'll enter a breakout room where you'll be able to select 2 of 3 different fields of expertise. One is clinical ethics, one is public health ethics, history, and law, and one is health, humanities, and arts. And in this space, you'll be able to talk more about courses in these areas, other learning opportunities, applications of these perspectives to health professions, and just ask questions to all of our faculty. Lastly, we'll conclude with Q&A about the program and next steps, and we're really excited to answer your questions. So just to wrap this up, in a world where health professionals face increasing complexity and challenges, we are going to offer you not just knowledge and skills, but a community of practice, which is committed to bringing human-centered perspectives to health challenges. And we really look forward to welcome you into this community. So thank you. And now we're going to transition to our fall 2025 course showcase. And I have the privilege of kicking us off. So I'm going to tell you about a course that I'm going to co-teach this upcoming fall called The Art of Observation. And I want to first introduce with you Kathy Flates, who is here with us in the Zoom room.
Over
She can
there.
wave, and I'm going to ask you a very specific question after just a few notes about this course, Kathy. So hang tight.
All right.
Together, what I think is so special about this course is that we are bringing together and bridging perspectives from both global health and dentistry to this unique course. So whether you're just beginning your healthcare journey, you are working on mid-career skills, or you're bringing your wealth of experience and expertise to a new chapter, this course is designed for you. We'll meet Monday evenings this September here at Anschutz Medical Campus in our gallery and other art spaces. And we'll use visual art to enhance how you perceive and analyze what you see, which are skills essential in any healthcare setting. So if you think about it, when you look at a patient, a medical image, or even a colleague's expression, what do you notice first? What patterns might you miss? How do these observations shape your decisions? And you're going to learn a tool called Visual Thinking Strategies, which is a structured approach to observation that research shows improves diagnostic accuracy, enhances clinical reasoning, and builds collaborative skills. For recent graduates, these skills might give you an edge in clinical rotations. For established professionals, VTS offers fresh approaches to challenges that you're facing in your work. And for those who are changing careers or returning to healthcare, it gives you a foundation that honors your wisdom and helps you to build new technical skills. I think our course format accommodates busy schedules, just a few sessions plus independent practice. You'll master facilitation techniques, learn to create safe discussion environments, and apply these skills to clinical and community scenarios. I'm going to argue that these techniques that we're going to teach aren't just academic, they're transformative. And my colleague Kathy has actually taught this course among dental professionals and dental students. And I wanted to give her just a minute to share some of her observations from teaching this course to this community, because they're really cool.
So thank you very much. No, I thoroughly enjoyed this. And I think one of the things that's so important is that you really don't need to be an artist or have an art background. It's really about, again, interpretive skills and learning how you think as an individual. It's been really exciting to work with both actually medical and dental students together to see when they look at a piece of art, what do they focus on first? And you can just see this interchange and this dialogue as far as how individuals will actually describe something. And so what I found so powerful is that lots of times, especially in my area, in oral pathology, you look at things and people will go, "Oh, this is so interesting, Dr. Flights, but it all looks the same." And then you take a course like this and you realize, oh, there are borders and strokes and colors that blend. And you start then having that perspective and bringing it into the anatomy or what you're actually seeing in an individual, especially in my field in the mouth. And all of a sudden, I see this much more sophisticated interpretation of what an individual sees and being able to write that down and also discuss it. So those are some of the highlights of what I was able to see by actually bringing people together to art museums and to interpretive areas that, again, have created a safe environment for someone to be able to talk out loud what they actually are seeing.
Excellent. And we are going to turn this over. And who do we have next, Lori? Oh, we have Gabby with Moral Distress. Gabby, would you like to say a little bit about your course this fall?
Of course. Thank you so much. Hi, everyone. I'm Gabriella Agostero. I'm zooming in all the way from North Carolina, where I'm the Director of Clinical Ethics at Novant Health. I'm really excited to have the opportunity to teach a course with you guys this coming fall. So I am going to be teaching on moral distress in healthcare. Very briefly, just for those on the call that don't know, moral distress is a phenomenon that we have in healthcare where an individual knows the ethically correct course of action, but they're constrained in doing that correct action. So that can come as a result of role constraints. Maybe you're a nurse in a setting and you're unable to implement an action because of your specific role as a nurse. Could be institutional constraints. Maybe there's system policies that don't allow you to perform the ethical course of action, or even limited resources. So the issue of moral distress is something that's unfortunately becoming more and more common in the healthcare field, especially after COVID. We have a lot of burnout due to moral distress. So really what I'm looking to do is kind of bridge that gap and kind of illustrate how practical this is. In all of our lives, we've found that moral distress not only affects physicians and nurses, but it also affects, case managers, spiritual care. We're really seeing every single role in healthcare. So throughout the course, what our aim is to really answer these three questions that we see on the screen. So diving more in depth into what moral distress is and how we recognize it, how moral distress influences the healthcare professional. So what happens if moral distress goes unaddressed? What can happen to our employees? But also most importantly is what tools and techniques can be implemented to mitigate moral distress. So my goal here is to, give you guys resources to implement into your daily practice to really address this issue and help prevent burnout and, uh, just basically giving you a toolkit for your own practice. So I'm really excited to speak with you guys more throughout the night and answer all of your questions today.
Thank you, Gabby. And we have Kate up next.
Yes. Hi, I'm Caitlin Masters. I'm a social epidemiologist and assistant professor here at CU Anschutz in internal medicine and in the School of Public Health and Epidemiology. So I'll be teaching a class this fall on reflections on incarceration and well-being. It'll run Tuesday evenings for the kind of full semester and be 2 credits, really focusing on understanding how the system and structure of mass incarceration intersects with public health and with health equity. And really centering the experiences of individuals. Part of the reason it's in person is because it's really based and rooted in the experience of people with histories of incarceration in the legal system. And so they come to our class most weeks. These are my colleagues and community partners, and really focused on what Katie referenced earlier with the community engaged emphasis here. And so they'll share their experiences. And so the goals of this class really to provide this broad understanding of mass incarceration as a structural determinant of health that those of you in clinical practice or in public health or in other spaces, it's often kind of left out of that broader training. So trying to bring this in as a system that a lot of folks interface with and create health inequities throughout our population. We'll apply critical theories and frameworks around public health, critical race practice, and lived experience criminology to study mass incarceration and health, and root our understanding of data and issues in the lived experience of currently and formerly incarcerated individuals. This past semester, it included also going to one of the carceral facilities, about 5 minutes from campus, one of the men's prisons, and talking with some of the guys there about the meaning of studying this without that lived experience and kind of having a conversation about that and what it should look like. We cover topics including kind of the history and some basic grounding around mass incarceration, critical theories and frameworks, how deaths are conceived of and overly naturalized in these settings, as well as health and healthcare, conditions of confinement, focusing on disability justice and aging, birthing and parenting in these spaces. There's so many different topics and conditions of confinement and kind of what our role is in our various backgrounds and addressing the system and in conceptualizing it. So looking forward to speaking with you all and answering any questions anyone has later.
All right. And who do we have next? We have Nancy. Hi, Nancy.
Mute. Hi, everybody. Everybody hear me okay?
Yep.
Okay, great. Thank you so much for taking the time to be with us today. I actually wear a few different hats. I have sort of an unusual background. I've been involved with the Center for Bioethics for a number of years as a board member, and I've been on the Holocaust genocide side of the center, and I also have been involved in the community board for a number of years. So the other hats I wear are I'm not a clinician, but I have a lot of lived experience as a family member and as a patient and as a teacher of storytelling and of narrative writing. I've written a few award-winning books. I've ghostwritten books. I'm a certified instructor in guided autobiography, which is an evidence-based curriculum that was developed at USC as a way to help people reflect on meaningful life experiences. And in this course this fall, which I'm so excited to be teaching for the first time here, I'm going to introduce some of those techniques. So I also work for Denver Health, which for those who are not familiar with Denver Health, it is the oldest and largest safety net healthcare system in Colorado. It's actually older than the state of Colorado and older than Denver. And I have 3 different roles that I play there right now. I work for the CEO, Donna Lynn, and I do all of her writing. So I am writing the internal comms, the external comms, op-eds. I've just been writing an op-ed about why Medicaid cuts are catastrophic for every American. I write narrative pieces. I also work with our chief medical officer, Dr. Reed Pierce, who is also on the faculty at the School of Medicine. And I edit a newsletter called Medical Matters. And as part of that, I interview our clinicians to help them to get to tell some of the human stories behind the work they do and the patients they serve. And then I also am working now more exclusively with the Dr. Chris Thurstone and his department. He is the head of behavioral health for Denver Health, which is actually and we are the largest behavioral health provider in the state. And I'm working specifically with him on some narrative concepts. So I'm really excited about this course. The idea is to, you don't need to come to this being a writer. So I just want to say that right off the bat, all levels of experience are welcome. And if you are somebody who maybe feels a little bit gun shy about writing, I promise that this course is for you. If you are somebody who has a lot of experience and feels comfortable writing, this course is for you. If you're somebody who really just likes to write in the academic sector, because I work with a lot of doctors who are like this, they don't understand how to take what they're doing and to make it have more human interest because maybe they really want to tell this story. This is for you. So we're going to have a lot of fun. We're going to do a lot of close reading because you get to be a better writer by becoming a better reader and listener. I'm going to teach you some craft techniques, and we're all going to really understand. We're all going to sort of help to mine some of the stories that we may be sitting on that we want to express. And we're going to learn from each other how to do just that. So there's so many benefits to narrative medicine. This is a field that there's a growing body of research around that really demonstrates how narrative medicine can be essential for healthcare providers. It reduces burnout, which we've heard about a lot today already. It can mitigate moral distress, which we've been hearing about. It can make you much more empathetic. It can make you a better listener, a better provider in numerous ways. So I'm really excited, and I hope that you'll have questions, and I hope you'll come join me this fall.
Thank you so much. And I think our last presenter is Matt.
Hi, guys. This is a little bit of a different course because this takes place largely in Poland. And we will be going to a medical conference, which has been going on for about 7 or 8 years now. It's an annual conference mainly of historians, and it's specifically historians who are interested in the roles that medical professionals played in Nazism and the Holocaust. The story behind this is actually fascinating. This conference was developed because there was he's actually a gastroenterologist in Poland who was in the stacks in the library at his university there, which is one of the oldest universities in the world, by the way, the Jagiellonian University. And he found a set of issues of a journal called Medical Review Auschwitz. And he had never heard of this journal before. It was published for less than 10 years, and it was published only in the years right after World War II. And he starts looking through this and realizes these are journals that describe the experiences of health professionals in the camps in Auschwitz and Birkenau. And these were both the experiences of perpetrator physicians as well, and nurses and so on, as well as stories of victims who were in the camps. And this got him really interested in this history. And so he has obtained funding and put this conference on every year since, I believe, 2018 or 2019. And for the last 3 years, we have been privileged to take students and early career professionals to this conference. So we're offering this again. It will be offered for credit if you want to get credit. Not everyone who goes is actually going to do it for credit. So this is sort of an optional thing, and it will be essentially as an independent study for as far as the international aspects of this go. It's not an official travel abroad program for the university. But it is an authorized and sanctioned travel abroad program. So we'll spend 1 full day in the camps. We work with the Auschwitz-Birkenau Memorial and Museum on this program, and so we have access to certain areas of the camps that you don't normally get access to if you're just a tourist coming through. And we will be there with leading historians worldwide, some of the top historians in the world on this topic of medicine and Nazism and the Holocaust.
All right. Thank you, Matt, for sharing about this really exciting opportunity. We're going to turn now to Lori Monroe, who's going to tell you more about the logistics of joining our program.
Hi, everyone. I hope this visual of our Fall 25 course schedule helps summarize our offerings for you. We have imagined this program to fit the needs of healthcare professionals. We are offering 1 to 3 credit options in various classroom formats, with courses starting at different dates and running different lengths of time. And while our courses are flexible, unfortunately, the registration system is not. As with most innovations, systems processes take a while to catch up. So if you are considering any of the classes, the timeline is essential to understand. So let's take a look at some of the dates. The May 30th application deadline is the rate limiting step to this equation. The graduate school requires that all applications for the fall semester be submitted by May 30th. Once you've matriculated into the graduate school as a bioethics and humanities and health student, you have between July 7th through September 5th to enroll in a course. If you are a CU employee, the application for the tuition assistance benefit opens approximately on August 1st, and it lasts until September 5th to apply. So the big date for us is May 30th. And so I recommend, if you're just thinking about taking one of our classes, please submit the graduate school application by May 30th. It is not a commitment to take a class. It is simply opening the doorway to take a class. And it won't cost anything because we are covering the graduate school application fee. And once you've matriculated into the graduate school, you'll be all set to register for a class for this fall or next spring semester. So if you have any questions about this process or this program, please just reach out to me. And for attending this, you'll also be receiving an information packet from me in the mail as a follow-up to how to get this process going.
Okay, so next up, what we wanted to do was just to give everyone here just a taste of the different kinds of expertise we as a faculty bring to this program. And so instead of just one, we're actually going to give you a chance to join 2 rooms of the 3 to kind of learn more from everyone here, ask questions, other kinds of educational opportunities on campus. The conversations can go however you want them to go. So we're going to give you a chance to join a breakout room. Don't worry, you will get another one in a few minutes. So we're going to bring you into either choose 1, 2, or 3. And then after several minutes, we'll bring you back in and you can join 1, 2, or 3 again. Welcome to stay. We are going to open the floor to any questions you have. If sound is a problem, no, you can put it in the chat, but please feel free to shoot us some questions.
I have a quick general question. Thank you for sharing this evening. I know that right now you guys on your website have the fall 2025 schedule. Do you know like timeframes when you'd be releasing information about winter, spring, and other semesters going forward?
I think our goal is October for sure. Enrollment begins late October, I believe. We already know the courses we're going to offer in the spring. We're just going to work out timing to make sure that we can meet as many different kinds of schedule demands as we can. So we can tell you the courses happily, but we can also, we'll know the timing and the formats as we get a little closer.
I have a question for people who live in Colorado Springs. Um, is will there be other like virtual options for higher credits? So I think currently there's only 1 credit course that's virtual. In the future, will there be like 3 credit courses that are also virtual options?
Yeah, for sure. In the spring, we're going to be teaching Foundations of Health Humanities and Ethics, which is a 3 credit course. It'll be available either in a hybrid or online format, and it'll be really easy so you can get all 3 credits that way. And if we have basically how this program will work, if we have the demand, which means 5 students, we can offer additional courses. So we're kind of testing the waters here to see about interest and how many folks are available to take a course. And if we get 5, the course can run. So we have a lot of instructors eager to teach.
Thank you.
All right. I may be cutting us off a little, but I want to let you know, everyone here, that Lori is really your guide. So when you make up your mind, if you want to go forward, the first thing you do is drop Lori an email. The process is, I'm not going to say it's fun. It's not. It's really densely bureaucratic and maybe frustrating or confusing. And Lori is going to talk you through every step all along the way to make sure all your materials are submitted, everything is covered, and you get in and get through. And we want to just re-emphasize the fact that you don't need to make up your mind about a course right now. You just open the possibility of taking a course at any point over the next academic year. We just are stuck with this really rigid deadline from the graduate school that to get into a course in the fall, you have to get in by May 30th. So we want to do everything we can to make this as easy as possible for you and to get you through these hoops so we can just jump into the fun part of this program. So yeah, communication is really key. If you get stuck or confused, reach out and we are here to walk you through it. So don't let that be a barrier to joining us. Any other final words from anyone here? All right. Well, thank you all for coming. We're just delighted. You're going to see an email from Lori with a resource guide. We're going to share the video as well as the slides with you. So if we went really fast, which we did, you can go back and look it over. And there are so many, it's May and it's crazy month on the Entries campus. But if you have time, we have some really awesome talks, programs, concerts, art openings, student group meetings, and so much more going on in our center over the next few weeks. So you should feel free and welcome to come to anything. And we are just happy to have you in our community. So thanks for taking the time today.
Thank you.
Bye, guys. Yay. Yay. Excellent.
Great job. That was amazing.
it. That was so many people. We did it. That was amazing.
Yay.
Even though there were 11 of us who were like instructors and connected already to the center.
But that was really exciting just for me to learn about other instructors' courses. There's some really interesting ones being taught. Oh my gosh.
No, I really want to take everything. I feel
I
like
know,
that's the
same.
curriculum decision making is if we want to take it, it's probably really good.
Yeah. Are we, not for this upcoming semester, but are the instructors able to take other courses? How does that work?
We need to like figure it out, how to like, it's less about the like intellectual things and more like how to add you into a Canvas course
Oh,
makes it
gotcha.
so difficult.
Yeah.
So if we can like get past the like bureaucratic hurdles, I think all the instructors are welcome to join and learn.
Okay. Yeah.
Yeah, so cool.
Good to know.
Um,
Well, thank you so much for everything and all your hard
Thanks for
work on
joining
this.
in this late. I know for you it's
Yeah.
late, and it's like, what if you have a party and no one comes? So
I know. It went great though. Thank you for all your hard work.
yes, all right. Well,
Have
hang
a
in
good
there
night.
and we'll be in touch, especially about the questions of faculty status and how to actually get you paid, most importantly.
Perfect. That sounds great.